Hello, my name is Naja Matthews. I am currently in my last clinical rotation for the OR track. This is my podcast 2, centered around informatics and leadership. This unit uses informatics for communication, support, and decision-making. The EPIC system is a multidimensional computer health system used for several modes for communication. On this unit, use of the Orders tab is a primary communication method for the nurses to implement their interventions. The Orders tab includes specific medications and parameters the physician orders for the patient that must be acknowledged and released by the nurse to begin care. Occasionally, there may be a question about the orders or an order that is not present that the nurse would like to instill. The Notes tab in EPIC is a way of communication used in these cases. The provider is sent a message directly through notes for easy viewing to respond quickly so the nurse can resume care. Support and decision-making are made through the EPIC system as well. A more independent use of informatics that allows the nurse to make decisions is the use of the monitor machines that the patient is connected to. The information nurses have available to them to make decisions on this unit are often immersed in unit-specific training or standing orders that are available for use upon the nurse's discretion. On this unit, there are standing orders and interventions that can be made based on the patient's monitor signs. The Vocera is an informatics instrument used to communicate across and within units to every personnel who also has one for easy communication and support. These are used to ask questions, confirm information, or even seek approval for a decision such as a verbal order. On this unit, use of the Vocera is minimized as EPIC is the main mode of communication and it enhances a less simulated environment for the patients. They are still available for use within necessary situations upon nurse user discretion. For leadership, the management style of this unit is quite different than a traditional floor. The nature of the unit's nursing is more of an independent style on this floor, as the nurses often operate from their individual bays. There is less check-in with management about interdisciplinary team checks, discharge orders, report on patient cases, etc. Management is involved more for delegation of bay assignments and unit-specific management needs, rather than managing the nurse's involvement with patients like in traditional floor nursing. The model seen on this floor is the total patient care model that encompasses total nurse responsibility for the patient while assigned. Nurses on this floor are providing focused assessments of patients as they come out of the effects of anesthesia post-surgery, yet are still responsible for their overall health and well-being. The difference in the total care model on this floor that varies from other floors is a less holistic approach to care, though. Traditional nursing floors must highly consider the patient's medical history, current medications, current chronic illnesses, and more. This unit, although implementing the total patient care model, is acute condition based, as recovering from anesthesia is a critical acute condition. It is rather heavily based on the patient's current status. Few other factors of the patient's medical history are considered due to prioritization of recovery nursing and the short turnover times. Both transactional and transformational exchanges are performed by nursing staff. A transactional exchange or extrinsic motivation that occurs on this unit is the expectation to meet time-specific requirements such as charting and medication administration. Due to the high acuity level of these patients, charting and medication administration expectations are a high motivation mark, as the status of patient's condition can change quickly and may yield negative consequences for the nurse if not met. Stabilizing the patient's level of consciousness and pain levels are the main goals of the nurses in the priority transactional interventions. Transformational exchanges are performed on this unit through the internal motivation to promote patient comfort. Nurses may offer ice chips to soothe throat irritation from recent intubation, offer warm blankets or repositioning, and other as-needed medications outside of pain for added comfort, such as Zofran for nausea. This makes nursing on this floor less task-oriented by incorporating these soft skills that enhance patient experience. So far, this unit has been my favorite of all the locations in the OR track, and I am excited to learn how more core tenets are used for the next podcast.